Walk into almost any state-of-the-art clinic today, past the tablets and the digital check-in kiosks, and you will find a piece of 1980s technology quietly dominating the workflow: the fax machine, blinking away and demanding attention. According to a recent Medical Group Management Association survey, 89% of healthcare organizations broadly still rely on fax machines. That includes the most advanced hospital networks and modern private practices in the country. This reliance comes with a heavy clinical toll. The Documo 2025 survey found that 88% of healthcare practitioners report fax-related delays directly and negatively affect patient care. Fax is not disappearing. Instead, it operates as a permanent infrastructure bottleneck that degrades the quality of medical response and chokes operational efficiency. Consider the life cycle of a single complex document. When a multi-page prior authorization packet arrives, a staff member must manually identify the patient, route it to the correct department, enter the data into the EHR, and then pick up the phone to track down the inevitable missing clinical details. This visual breaks down a standard medical workweek to show where that time goes. Look at the massive allocation strictly for prior authorizations, which overwhelmingly arrive via fax. Physicians and their staff are dedicating an average of 13 hours per week just to clear these requests. That crushing administrative load creates a secondary economic strain. Front office turnover rates have hit 40%, running parallel to steep upward curves in administrative compensation. Practices are trying to solve the problem by hiring more people for the exact same manual workflow. Between 2019 and 2024, practice spending on prior authorization staffing alone jumped 43%. Paying premium wages to replace burnt-out staff doing manual data entry turns fax management into a persistent financial leak that erodes a clinic's profitability year over year. Many practices try to modernize by moving to a digital fax solution, but swapping a physical machine for an email-style inbox does not eliminate the actual labor. The manual sorting, the indexing, and the follow-up work all remain intact. Attempting to build a fully automated system internally requires massive capital and enterprise-grade IT support. If that infrastructure fails, the financial stakes are severe. The average cost of a healthcare data breach now stands at $4.9 million. The structural correction is Staffingly. They are a US-based outsourcing company that deploys dedicated virtual medical assistants, trained specifically in complex medical document workflows. Software alone cannot fix the bottleneck. True operational relief requires offloading the entire workflow to a specialized, secure infrastructure. This diagram illustrates how Staffingly processes an incoming medical referral. The first technological pillar is HIPAA-compliant optical character recognition. As the document arrives, the technology automatically digitizes it and extracts critical data, like the patient's name, medical record number, and ICD-10 codes. Next, intelligent machine learning logic analyzes the extracted text to classify the document type. The algorithm automatically sorts and routes the paperwork into specific digital pathways for referrals, lab results, and prior authorizations, operating with over 95% accuracy. The final crucial pillar is human oversight. Trained healthcare specialists review the AI-processed output to catch the complex edge cases and messy handwriting that pure automation inevitably misses. This human verification happens before a single piece of data enters your patient records. By keeping a qualified specialist in the loop, Staffingly maintains an error rate below 1% across their entire client base. Relying entirely on AI is too risky for sensitive clinical data. Against a $60,800 in-house cost, the Staffingly model costs just $21,600. That is a 64% reduction, delivering nearly $40,000 in annual savings per full-time equivalent. Over 800 healthcare providers across all 50 states are already utilizing this hybrid infrastructure to process their daily volume. By outsourcing this burden, practices reclaim thousands of staff hours and protect the profit margins that manual fax management would otherwise consume. Transitioning to Staffingly requires minimal downtime. The entire go-live timeline takes just 48 to 72 hours, which includes seamless, native integration with dozens of major EHR platforms. The service is highly adaptable. Practices can scale their support up or down with 30 days' notice, completely free from the trap of long-term vendor contracts. To see the exact cost-saving numbers for your specific practice volume, visit staffingly.com/demo or call 800-489-5877 to schedule a free 15-minute consultation. Continuing to process faxes by hand means choosing to spend staff resources on an obsolete system. Taking action today modernizes your practice, stabilizes your margins, and ultimately protects your patient care.